Welcome, everyone. Sorry to keep you waiting. We are in the middle of a vote, and so I had to vote, and honored to be here with Representative Brownlee and some absolutely fantastic champions. Right now, as we stand here on this beautiful day in Washington, D.C., women are in harm's way. Women in uniform, risking their lives every day in this country, defending our democracy and our freedoms. Women are the fastest growing group of veterans in the United States. Women serve, and women's reproductive rights and abortion care are health care. That was recognized by the Department of Veterans Affairs until just months ago, when the rule adopted by the Biden administration was reversed and abortion care was banned and counseling was also halted by the Department of Veterans Affairs. This kind of ban on health care and gagging of counseling is absolutely abhorrent. It is a betrayal of women veterans and of all veterans, as well as Americans, because this kind of care is essential to women, as we have heard from women veterans who are scared. They are petrified. They're fearful of getting pregnant while enrolled in a healthcare system, unable and unwilling to prioritize their lives and health if something goes wrong. Many of them suffer from service-connected disabilities that increase the risks associated with pregnancy, and many have experienced military sexual trauma during their time in service. To betray them and take away this kind of health care, their ability to receive an abortion in the most harrowing of situations, is unconscionable. Today, we have an opportunity to overturn this cruel and dangerous policy impacting hundreds of thousands of women veterans across the country, because in just a couple of hours, we will be voting on our Congressional Review Act resolution to overturn the Trump administration's near total ban on VA abortion. This administration recently took away that ability, and we are determined to restore it. I want to recognize and thank the reproductive health advocates and veterans alongside us in this fight. I'm honored to be leading it, along with so many great partners, including Leader Schumer, Senator Murray, and Representatives Brownlee and Takano. And again, I want to thank Representative Brownlee for being here today. We simply can't let the Trump administration deprive women veterans of the care they need when they most need it. And if my Republican colleagues really believe in protecting women veterans who have been raped or whose health is at risk, they should support this resolution. I call on them to vote yes and support us in this effort. And I am honored now to turn the podium over to Representative Julia Brownlee.
Thank you, Senator. Thank you very, very much. And good afternoon, everyone. As the Senator just said, later today, our Senate colleagues have an opportunity to do the right thing for women veterans by voting to reject a dangerous VA rule that restricts access to abortion care and counseling. This resolution of disapproval makes clear that denying medically necessary reproductive health care has no place at the VA and has no place in our country. VA's mission is to serve those who have served our nation in uniform. Yet this rule moves us in the wrong direction, limiting essential health services for the fastest growing segment of our veteran community. Women veterans already face significant barriers to care, and restricting reproductive health services only deepens those challenges and puts their health at risk. There's not a single medical condition affecting male veterans for which the VA denies care. But when it comes to women's reproductive health, we continue to see restrictions driven by ideology rather than their medical need. Today, the Senate faces a clear choice: to overturn this harmful VA abortion rule and restore veterans' access to reproductive health care, or they can vote to uphold a near total ban on abortion care and counseling and continue stripping women veterans of their rights that they have earned through their service to our country. I want to be clear about what this rule would do in practice. This rule would prohibit abortion care even for survivors of rape or incest, deny care to women facing serious pregnancy risks, and silence VA providers from offering critical medical guidance. Under this policy, the very department charged with caring for those who served would instead restrict access to medically necessary reproductive health care for women veterans whose service may already have affected their reproductive health. Let's be clear, efforts like this are part of a broader strategy to impose a nationwide abortion ban through incremental restrictions. We cannot allow women veterans' health care to become a testing ground for that agenda. And that is why I'm proud to join Senator Blumenthal in advancing this CRA to formally disapprove of this harmful rule and send a clear signal that Congress rejects these restrictions. Veterans have upheld their duty to our nation. We must uphold our responsibility to them. I urge my colleagues in the Senate to stand with women veterans and vote in favor of this resolution. Women veterans deserve better, and they deserve action now. Thank you very much.
Thank you very much. Well done. Next, Naomi Mathis, who's Deputy National Legislative Director of Disabled American Veterans.
Good afternoon. My name is Naomi Mathis, as the Senator mentioned, DAV's Deputy National Legislative Director. DAV recognizes that abortion is a deeply sensitive issue that elicits strong views by Americans from different backgrounds and across the political spectrum. DAV believes that medical services available to veterans through the VA medical benefits package should not be reduced or taken away as a result of regulatory or legislative changes. Any and all proposed policy changes must put veterans' health and safety first, especially for women veterans who may face complex reproductive health challenges requiring timely expert care. VA must continue to meet the needs of the growing women veterans population. However, on December 31st of last year, VA adopted a new regulation that significantly limits access to abortion services through the VA healthcare program. Unlike other federal programs, VA would no longer cover abortions for pregnancy resulting from rape or incest. This change is not consistent with the long-standing Hyde Amendment, and as a result, women veterans who rely on VA for their health care are now treated differently than women using other federal health care programs. A female service member who was raped prior to transitioning out of military service and who learned she is pregnant after enrolling in the VA healthcare system is no longer covered by VA to have an abortion. If she was still on active duty, DoD would pay or perform the abortion. If she works for VA, her federal employee health insurance will pay for the abortion, and even if she is serving time in a federal prison, her abortion would be covered. However, as an enrollee in the VA healthcare system, She is not covered even for an abortion resulting from rape, and this is not right. For all of the above reasons, DAV supports the effort to repeal this unjust regulation and
Blumenthal and Senator Schumer for inviting me here to be here. As a country, we honor veterans' service by ensuring that they receive the health care that they've earned. This includes access to the full range of reproductive health care that they need at VA. But contrary to this belief, VA moved forward with a rule that restricts veterans' rights and access to comprehensive health care. Trump's VA is responsible for this rule change, which rescinds a Biden-era VA reproductive health care regulation that provided veterans with access to abortion care in instances of rape, incest, a threat to life or health, and that allowed VA providers to discuss abortion with patients who were experiencing high-risk pregnancies and pregnancy complications. With recent rulemaking, VA now has the most restrictive abortion policy of any federal health care program. Let me repeat that. VA has now the most restrictive abortion policy of any federal health care program. That means federally incarcerated individuals now have greater access to reproductive health care than veterans do at the VA. Now, this is a reality that I am unwilling to accept. And that's why I proudly support and join my colleagues' efforts to overturn this rule through the resolution of disapproval the Senate is set to vote on tonight. All eyes will be on Senate Republicans tonight. Will they vote to grant women veterans the freedom to make their own health care decisions? Or will they vote for our government to be in charge of veterans' health care decisions, even in matters of life and death? I urge them to vote in favor of the joint resolution of disapproval under the Congressional Review Act. Veterans fought for our rights. We must now fight for theirs. Thank you, Senator Blumenthal.
Thank you. Very pleased and honored to introduce Jess Finucane, Director of Policy and Advocacy at the Iraq and Afghanistan Veterans of America.
Good afternoon. I'm Jessica Finucane, Director of Policy and Advocacy for Iraq and Afghanistan Veterans of America. I'm here today calling on Senate to vote yes tonight to rescind the VA's near-total abortion ban. For many women who've served, the VA isn't just one option for health care, it is our sole health care. It's meant to be comprehensive. It's your primary care, your mental health care, and your specialty care. In my own case, it is my health care, full stop. That's the promise we as a nation have made to those who have served. And right now, that promise is being broken. I want to walk you through what it actually might look like for a woman veteran. So a woman veteran finds out she's pregnant, maybe unexpectedly, maybe as a result of trauma, or maybe it's a high-risk pregnancy. She's already receiving all of her health care through the VA. These are the people who know her history, understand her service, and her trauma. These are the people who she trusts will take care of her and her whole health. So she does exactly what we would expect, the same thing I would do. She goes to the VA for counseling to at least see what her options are, and she's told, "We can't help you." Now completely dismissed by the only healthcare system she knows, she's on her own. Now she has to navigate a fragmented, unfamiliar healthcare system in the middle of a crisis, and we all know the U.S. healthcare system is not easy to navigate even on our best day. She might have to travel across state lines, take time off for work she might not have, find childcare she may not be able to afford, pay 100% out of pocket for care she was already promised. And perhaps hardest of all, she now has to trust a complete stranger with her most intimate healthcare concerns. You'll hear people argue that she could just go somewhere else, but that assumes somewhere else is reachable, affordable, or safe. For many women veterans, that's not the case. That's not access, that's abandonment. Let me be clear, we are not asking for unlimited abortion access through the VA. We're asking for narrow, critical exceptions to remain when a woman's health is at risk or in cases of rape or incest. Situations that are already devastating, already complex, and already heartbreaking. Importantly, this is not just my opinion. It's what veterans themselves are telling us. In an IAVA flash poll, a strong majority of our members support access to abortion care and counseling in these limited circumstances. Alarmingly, over 60% didn't even know this change had happened, meaning this policy is not only out of step, it's happening without veterans even being aware. Imagine showing up to your hospital on your darkest day only to realize they won't even talk to you about your options. The VA is meant to provide holistic, comprehensive care. To carve out reproductive health is not just a gap in coverage, it's a failure of responsibility and a disgrace to the veterans who were told this country would take care of them. Women are the fastest growing group of veterans in this country. If the VA can't meet their full health care needs in their most vulnerable moments, then we're failing the veterans who have fulfilled a promise to this nation while breaking our own. We can and must do better. Thank you.
Thank you. Daria Neal, Senior Director of Policy and Advocacy for the Center for Reproductive Rights.
Good afternoon. My name is Daria Neal, and I'm the Senior Director of Policy and Advocacy for the Center for Reproductive Rights. For more than 30 years, the Center has fought to protect access to abortion and other reproductive health care around the world. I want to thank Senators Blumenthal, Murray, and Schumer, and Congresswoman Brownlee and Congressman Takano for your leadership and efforts to take this heartless policy off of the books. I also want to thank our partners in this fight, especially Power to Decide and the National Women's Law Center, who have fought tirelessly alongside us on this issue for many years. Veterans put their lives on the line to protect our freedoms, and now the Trump administration is taking away theirs. This policy is a complete ban on nearly all abortion care and even abortion counseling at every VA facility across the country. There are no exceptions for survivors of sexual assault or even when abortion is needed to protect the health of a pregnant veteran. Abortion can only be provided when a pregnant patient is on the brink of death. Since Roe v. Wade was overturned, the Center has represented many people throughout the United States who can tell you firsthand exceptions to abortion bans do not work in reality. Too often, patients are still denied urgent and sometimes life-saving care. Veterans and their families were promised excellent health care after making immense sacrifices for this country. This ban on abortion is a betrayal of that promise. So let's be clear. Abortion is necessary health care. Everyone who needs abortion care, regardless of the reason, should be able to access it. But for veterans, banning abortion, even in cases of sexual assault and health endangerment, is especially cruel. Health conditions like PTSD, severe hypertension, and chronic kidney disease are all more common among veteran populations, and each of them may make pregnancy more dangerous. Veterans may have sustained injuries while on active duty that make pregnancy dangerous. 1 in 3 women veterans also report having experienced sexual assault or harassment during their service. Many veterans have put off starting their families while serving. They, like everyone else, deserve to have all care options they need to make the decision that is right for them and their families. Abortion is a human right, and veterans and their families deserve better than this cruel ban. So Congress must act to right this wrong and rescind this dangerous policy. Thank you.
Thank you. And finally, Kayla Williams, Senior Advisor of the Vet Voice Foundation.
Thank you so much for the opportunity to speak today on behalf of the Vet Voice Foundation. I'm Kayla Williams, an Army veteran and former director of VA's Center for Women Veterans. Women veterans like me are more likely to have experienced military sexual trauma, and women who have been raped once are more likely to be raped again. MST is one of the reasons we have high rates of mental health conditions like post-traumatic stress disorder and depression that increase suicidality and may require medication to manage. Women veterans like me have been exposed to toxic chemicals in Iraq and Afghanistan and beyond, and we are more likely to develop deadly cancers as a result. Women veterans are more likely to rely exclusively on VA for our health care. And given those and other risks related to our military service, that is a good thing. We deserve care from providers who understand our experiences and needs. It is imperative that we be able to access the full spectrum of reproductive health care at VA, and abortion is health care. But the extreme rule we are talking about today goes beyond banning abortion. It even bars abortion counseling and has no exceptions for rape, incest, or to protect women's health. Preventing women veterans who have been raped from getting abortions is despicable. Barring women veterans with PTSD from even talking to their doctors about abortion care is appalling. Stopping a teenage girl on Champ VA who is the victim of incest from getting an abortion is repulsive. Banning doctors from counseling women veterans with cancer that abortion would allow them to start chemotherapy and radiation sooner, protecting their long-term health and ability to actually raise their children is despicable. Forcing doctors to weigh whether women are close enough to death to deserve abortion means women will die. This rule is the most stringent federal abortion ban. It means women veterans have less access to abortion than women on active duty and women who work at VA. It goes far beyond the Hyde Amendment. It is a test to see what Congress and the public will allow this administration to get away with. Will senators allow the VA secretary to risk the health and well-being of hundreds of thousands of women veterans? Will they let him strip access to medically necessary health care from women and girls? Will they allow women veterans to die? I urge every senator to vote for this resolution. Women like me took an oath to defend the Constitution and protect this nation. We are asking you to protect and defend us now. Show your constituents that you will not support this extreme and draconian rule. Stand up for women veterans today. Thank you.
We are happy to take any questions, if there are any. Yes.
Fairly recently, Senator Trevor blocked motions over access to abortion. Are you prepared to take similar measures, or is that something you're considering for this?
I'm considering any measures that will uphold women's health care and reproductive rights, including access to abortion and abortion counseling. We've been emphasizing the ban on care, but the gag on counseling is also abhorrent, and I will consider whatever it takes to uphold this right. Okay. Well, again, I want to thank our speakers, but literally everyone who is here today. You have been very powerful and eloquent. I wish my Republican colleagues could hear you. They should hear you, and they should heed you. And thank you very much for being here today. Really appreciate it. Thank you. Why don't we get a photo of all of us?